This segment of Delmarva Life is brought to you by TidalHealth.
The heart is a very sophisticated organ. When it's working right, you feel right. Blood gets pumped into the heart and blood gets pumped out of the heart and into the body through a series of valves, or little doors, if you will. Now, if one of those valves malfunctions, your heart doesn't work well and you don't feel well. Well, TidalHealth Peninsula Regional is now performing a procedure to fix this problem, and obviously that's important, but it's especially important because now more people can get this problem fixed. Joining me now is Dr. James Todd, cardiothoracic surgeon with TidalHealth Peninsula Regional. Thank you so much for joining us.
Hi, good afternoon.
So we're talking about something called mitral regurgitation. I guess in layman's terms, what is it?
So the mitral valve is the valve that lets the blood in from the lungs to the heart, and it keeps it going one direction out of the heart, and it can leak. There's lots of reasons for it to leak, whether it's torn or damaged. A lot of times the heart gets enlarged from a heart attack and it leaks. So if the valve starts to leak, when the heart squeezes, a lot of the blood will go backwards, and it makes the patients very short of breath, and they get weaker and weaker and more tired.
Yeah, and this can happen to older patients who maybe think that, this is just a sign of aging, but these can be serious symptoms, can't they?
Oh, very much. It will eventually go on to cause heart failure and heart damage. The patients can eventually die from it. It's tricky. Mitral valve is probably the trickier of the valves, one of the trickiest of the valves, because of how long it takes for the symptoms to begin. So they can live with the leak for many, many years, but eventually we'll have to try to slow the leak down, improve it, make it a little bit less, or stop it altogether. And that's what we've been doing for years, is open heart surgery, where we get into the chest, get into the heart, stop the heart, go inside the heart and fix the valve. And now we've had this new technique that's come out where it's allowing us, in some cases, not to have to be so invasive.
Right, because not everybody can undergo open heart surgery.
Right, that's the problem, particularly with the mitral valve. A lot of the patients come in pretty weak, and to stop their heart and start it again is such an effort. These patients may not survive the operation. And so it's very tricky with the mitral valve in terms of how the patients will do. But the surgery works very well for that. The surgery almost always completely repairs the leak. But there's some patients that were not able to do all that. And so this is this new technique that's come out, and it involves this technique called the mitral clip. And what this allows us to do is repair the valve when there's a leak by going up through the patient's leg. So we can put them under anesthesia, but just go through the leg of the patient, go up inside, and do some suturing basically with this clip to the leaflets, which takes the leak from severe down to mild to none.
Wow.
So it's a fantastic technique that allows us to work on patients without stopping their heart. They wake up with a little small hole in the leg and they can go home the next day or two.
Yeah, I was going to say, I imagine recovery time is shorter as well.
Yeah, it's super safe. Recovery time is very short. Right now, probably the biggest problem is just there's only a select few patients we can do this with. The indications will continue to grow, and it'll get to be something that will be much more usable through a whole lot of mitral valve patients. That's going to take some time.
Yeah. So you've already done this procedure twice?
Correct.
And how did it go?
It's worked nicely. The patients are doing well. But again, it's one where we just got to see how they do over time and keep following them and follow on echoes and see how the repair does.
But this is very promising to, I imagine, a lot of people here on Delmarva.
Oh, it's fantastic. And even though it's just the first step, that's what it is, the first step. This is opening up a whole world of other techniques we're going to be able to do via this clip. This clip platform allows us to do things that will come down the line in the next few years. There's several techniques in replacing valves and repairing valves.
Well, that's wonderful news, and thank you so much for joining us this afternoon to deliver the news. Dr. James Todd, a cardiothoracic surgeon with TidalHealth Peninsula Regional. Thank you.
Thank you.